Hello, I'm Lorraine Downes. I'm a daughter, a wife, a mother, a sister. My family is everything to me. Like most families, we've had our share of health problems. My dad died of a heart attack, and my niece and my husband have had cancer. Through it all, my mother's been there for us, 100%. So when Mum was diagnosed with breast cancer, my sisters and I were devastated. But she went through all of the treatment, and thankfully, she's right here with me now. My mum and I know a lot more about breast cancer than we did a couple of years ago. The New Zealand Breast Cancer Foundation have asked us to share our story with you, so you'll know why it's important to take care of your breast health as you grow older. So I'd like you to meet my mother. This is Gladys Downes.
Hi.
So Mum, how did you find out that you had breast cancer?
I was reading an article in a magazine about a woman who'd had breast cancer, and I thought, I'd better give myself an examination, and I found a lump. I went along to my doctor, and he examined me and said, I think this is serious. And so after a series of tests, he found out that I had breast cancer.
So Mum, when he said, Glad, I'm sorry, but you've got breast cancer, how did that make you feel?
I was surprised.
Yeah. I can remember that my sisters and I, when we found out, we were absolutely shocked because we said, how can Mum have breast cancer? She's in her 70s. We always thought you were past that stage of danger of ever getting breast cancer. And I remember, Mum, that when you were younger, I can remember you going for mammograms, but what age did you stop having mammograms?
At 69, because that was when the government funded scheme stopped.
Yeah. So mammograms are free up to the age of 69, and you thought, well, I'm safe, I don't have to have another one. And I think that's what a lot of women think, but you know, it's really important to know that you've got to keep having your mammograms after the age of 69. So, Mum, you were diagnosed with your breast cancer. So what treatment did you have to go through?
Well, first of all, there was the chemotherapy and then the radiation, and that was over a course of about 5 months.
So you had the double mastectomy and then 5 months of chemo, radiation. What was the hardest thing?
Well, the chemo was quite hard because of the nausea. And also the radiation makes you very, very tired.
But you had great care, and the treatment that you went through, it was worth it in the end.
It certainly was. I'm just so grateful to be alive.
Yeah, and we're so grateful that you're here with us. And if you know, when you think about it, if you hadn't examined yourself, it could have been different.
I would say keep having mammograms because that's the best way to detect breast cancer.
Remember, you're important to your family. 70 isn't old. Don't stop having mammograms. Your risk of breast cancer in your 70s is as high as when you're in your 50s. And mammograms are the best way to detect breast cancer early. Remember, when you catch it early, you have a better chance of survival. It's $150 well spent.
In the early stages of breast cancer, there's usually no pain and often no symptoms. But as the cancer grows, some signs may appear on the breast, and they may include a new lump or thickening of the skin in the breast or armpit area, or changes to your nipple, for example, a newly retracted or inverted, pulled-in nipple, or there may be crusting or ulceration on the nipple. Another sign of breast cancer could be if the skin changes on your breast areola or nipple, if there's dimpling, puckering, reddening, or any change in skin colour, or a rash which appears on your breast and doesn't go away, or if the shape or size of your breasts change, or you experience discharge from the nipple that occurs without squeezing. So if you experience any of these signs and symptoms, or any changes which are unusual for you, show your doctor.
Remember, your breast cancer risk stays high as you grow older, so keep on having your mammograms every 2 years. The earlier breast cancer is detected, the more treatable it is. At any age, you should know the normal look and feel of your breasts so that if there's any changes, you can report those changes to your doctor. For more information, call the New Zealand Breast Cancer Foundation's advice line 0800 BC Nurse. That's 0800 2268 773. Or you could visit www.nzbcf.org.nz.